Okay, self-assessment for this chapter. Chapter 15, the patient with medically unexplained physical symptoms. Let's start with that. A 26-year-old male teacher attends his general practitioner requesting tests to confirm that he is suffering from multiple sclerosis. He thinks that he has this because he had some stabbing pain in his upper arm last week. The pain has now resolved and examination is unremarkable. Which one of the following should the GP do? Watchful waiting, refer to urgent neurology appointment, organize magnetic resonance imaging scan and lumbar puncture, tell the patient that he is worrying too much, organize another appointment in 3 days. I think the answer would be A, watchful waiting. These situations are commonly encountered by GPs, so the patient may well be developing multiple sclerosis, okay. However, this symptom of, just some numbness or something, this is minimal and insufficient to make any diagnosis. Okay, so you need to wait and see. That's it. Wait and see. Second case, a 25-year-old woman insists that she wants plastic surgery on her nose, as she feels it is crooked and deformed. She has stopped leaving the house for fear of other people noticing. She cannot stop thinking about how ugly it is, and this often keeps her awake at night. On examination, her nose is entirely normal, and she does appear slightly reassured when told this. Which of the following is the most likely diagnosis? Somatic delusional disorder, factitious disorder, malingering, body dysmorphic disorder, or hypochondriasis? We are talking about body dysmorphic disorder, of course. A 32-year-old former nurse complains of pelvic pain. Despite the apparent severity of the pain and the presence of multiple abdominal surgical scars, her physical appearance, examination, and basic investigations are entirely normal. She tells you in detail about her previous diagnoses and invasive investigations and requests pethidine and a diagnostic laparoscopy. She is visiting from a distant town. Which of the following should be the next step in her management? Urgent diagnostic laparoscopy, prescribe pethidine, tell her that she is lying, contact previous centers of care, refer to psychiatry. I would say that you need to contact previous centers of care, because this history is highly suggestive of factitious disorder, of course. Female patient, healthcare professional, and she's a nurse. Multiple symptoms without signs, broad knowledge, specific demands, far from home. All of these are, signs that are suggestive of factitious. It is imperative to contact previous hospitals to get more information, of course. However, asking the patient for such contact details may yield vague answers in some cases. So that's it. A 72-year-old man is referred to psychiatry because of dyspnea and stabbing pain in his chest. He has not seen a general practitioner for years, and examination and routine blood tests are normal. The medical doctor feels that he has panic attacks. Which one of the following should be the next step in his management? CBT, further physical investigations, explanation of functional illness, antidepressant medication, watchful waiting. I would for this particular man, we have 27-year-old man, and these symptoms, we may do further physical investigation, of course. Okay, because such a man with this age, with no psychiatric history, presenting with these symptoms first time, so this is unlikely to be psychiatric. So you need to do more investigation to look for any organic disease. Okay. A 41-year-old woman is a frequent visitor to her general practitioner. She has had numerous investigations over several years for a multitude of physical symptoms, including abdominal pain, dysmenorrhea, dysuria, and difficulty swallowing. She refuses to accept her GP's explanation that there is no physical cause for her symptoms. She is now requesting a referral to a neurologist because she has a persistent tingling sensation in her legs. Which of the following is the most likely diagnosis? Multiple sclerosis, factitious disorder, somatization disorder, hypochondriacal disorder, or generalized anxiety disorder? Here we are talking about somatization disorder. Of course, we have multiple symptoms and such. Okay. So let's go to the extended questions. Diagnosis of medically unexplained physical symptoms. We have Munchausen syndrome by proxy, body dysmorphic disorder, factitious disorder, somatic delusional disorder, schizophrenia, hypochondriacal disorder, somatization disorder, malingering, severe depression with psychotic features, and dissociative disorders. For each of the following scenarios, select the most appropriate diagnosis from the list above. A 23-year-old quit her job as a dancer 2 years ago because she is preoccupied with the idea her breasts are misshapen. Now she barely leaves the house, wears baggy clothes, and is requesting surgical augmentation. The cosmetic surgeon noted no abnormalities. So the patient has this body dysmorphic disorder, of course. An 80-year-old girl is drowsy. Her mother tells you that it is sudden onset. On examination, you find subcutaneous needle marks between her toes. One of the nurses finds an insulin syringe on the bedside while her mother is at the bathroom. So this is okay, highly suggestive of Munchausen syndrome by proxy. Okay. 21-year-old man is preoccupied by a small scar behind his ear, which he believes is where the government have implanted a microchip to insert thoughts. Okay, maybe we're talking about delusions, psychotics, schizophrenia or something. A 65-year-old man in a surgical ward with abdominal pain believes that he is dead and rotting from the inside. Okay, this is Cotard syndrome, but what was the options? Okay. These may be some kind of, severe depression with psychotic features. Maybe. Yes, that's the answer. Okay. A 45-year-old man complains of whiplash following road traffic accident and asks you to complete a medical report. He tells you he has been disabled permanently and always wears a neck brace. You saw him getting off the bus earlier that morning wearing no neck brace. So this is malingering. Okay. That's it.